We are proud that the JCF Special Gift Fund was able to act quickly and provide $1 million in emergency coronavirus relief to support the work on the ground which has been provided by UJA Federation of New York and its network of agencies. Throughout this three-part webinar series, you will hear about the Jewish communal organization's response to the COVID crisis, and we're also going to explore philanthropic responses to the crisis from the perspective of major philanthropists, experts in the field, and Jewish organizations at the forefront of the COVID response effort. Today, we're very excited about our first webinar, Responding to the COVID Crisis, Lessons Learned from Major Philanthropists. We are joined by Naamah Paley Rose, Senior Advisor at Rockefeller Philanthropy Advisors, who has extensive experience working with fund holders, foundations, and not-for-profits. She will discuss how leaders in major foundations responded during the early months of the crisis, what we learned, and how these fund holders are now thinking about the next phase of building and creating resilience. Naamah will also explain strategies for helping nonprofits that can be used by funders of all levels. We will leave time towards the end for questions that can be submitted through the chat function. And now I'd like to turn the webinar over to Naamah.
Thank you. Can everybody hear me, or people who are able to speak? Can you hear me? Wonderful. Hi, everybody. I'm Naamah Paley Rose, coming to you from my study office apartment in Brooklyn, New York. And I'm really just grateful for the opportunity to get to speak today and share a little bit about my experiences. I currently work at Rockefeller Philanthropy Advisors, which I'll tell you a little bit more about in a moment. But before my time at RPA, my first job out of college was at American Jewish World Service, and then at the New Israel Fund. I interned at UJA Federation and then at the Bronfman Fellowships. So my background is very much coming from the Jewish communal sector, especially with a focus in philanthropy. And then I pivoted after graduate school and started working at Rockefeller Philanthropy Advisors. So I'm gonna basically just start by I'll give you a little bit more background about the job that I currently do. Then I'm gonna do kind of a zoom out and talk about big philanthropy and what I've seen and experienced and contributed to in the sector when we think about big foundations in New York City and nationally and the work that they've done. Then I'm gonna kind of zoom back in on family foundations and individual donors, which I imagine is probably what's most relevant to the people on the call, and give you sort of just some things that I've noticed and thoughts and takeaways about how you may want to approach, how you may have been approaching your philanthropy since COVID hit in March, and how you may want to moving forward. And then I'm going to tell you a little bit about, my own philanthropy and how I've been kind of trying to approach it in this particularly complicated and tricky time. And then we'll open to questions and answers. I'm always kind of a sucker for questions and answers because, of course, in normal times, I would much rather this be, an open conversation and not just me presenting frontally at all of you. So certainly if you put a question in the chat, and I think Tamar is going to be the one facilitating questions and answers. And if she feels, I give you the power, Tamar, if you feel that you want to interrupt me and ask a question along the way, I really encourage you to do so. All right, I'm going to do a little bit of switching between sharing my screen and not sharing my screen. So I'll go a little bit back and forth, but hopefully it won't become too dizzying because nobody wants that. Okay, so this presentation is loosely called Responding to the COVID Crisis, Lessons Learned from Major Philanthropists. So just very brief context for what the organization is that I work for. I work for an organization called Rockefeller Philanthropy Advisors. We were founded actually just about 20 years ago, a little less than 20 years ago in 2002, out of the Rockefeller family office. The Rockefeller family, of course, are one of the founding philanthropic families in the country, and they had always approached their philanthropy, as they said, as a business. So unlike sort of what we think about as charitable giving, which is we see need and we make a contribution, they really always tried to think strategically. about the kind of change that they wanted to make in the world and how to make gifts that would align with the kind of impact that they wanted to see. So they kind of had this idea, the family members, the now I think 5th generation Rockefeller family members almost 20 years ago, which was that maybe other people are also interested in turning to advisors in order to give sort of more strategic gifts. So they started our organization. We now have a staff of almost 60. I'm based in New York, and I also have team members in Chicago and San Francisco and some in Europe, and we help all sorts of different donors with all sorts of different things. Our mission is to help donors create more thoughtful and effective philanthropy. We do that in a couple of different ways. My work is a mix of advising individual families and family foundations on every part of their philanthropy, the planning, the research, the actual grant making, the back and forth with their grantees, managing their board meetings, all of those pieces. And then I also have another piece of my work, which we'll talk about when I refer to one of my biggest clients a little bit later in the presentation, which is working with large foundations or corporate funders, especially on strategies, especially when they want to pivot. We often see that, you know, a large retail company will get a new CEO. The CEO will say to the team, "What's up with our social impact work?" The team might not have such a clear answer, and they come to us to kind of help think about what to do next and how to sharpen the vision of the work that they do. So let me go out of my presentation for a second. So we started, you know, like most people, working from home in the middle of March. And just, I wanted to kind of take you through a couple of different stories about what my work has looked like in these past 6 or 7 months. So the first thing is actually, I wanted to reshare this, is actually a quote I wanted to share with you from Darren Walker, the president of the Ford Foundation. This is from an article from June, actually, from the New York Times, where Darren Walker referred to getting phone calls from the many different nonprofit leaders that he and his team make grants to. And Darren Walker said, "There was a sense of desperation and panic from these usually self-assured leaders. There's never been such an existential crisis to the future of the nonprofit sector." And I just think that that's a really powerful quote that I thought would help frame what philanthropy has tried to do, given how unprecedented this moment has looked. And when I say this moment, I'm actually kind of referring to what we are now seeing as the convergence of two things, in our nation. First of all, just the COVID pandemic and the tremendous impact it's had on our population and on the nonprofit sector and on everybody. And then the fact that COVID kind of led into what became these racial justice protests in June, which really, as far as I understand, arose out of the really disproportionate impact that the crisis has had on health, on financials, especially in communities of color. So that sort of pivoted from like our nation has a health crisis to our nation has a health crisis, and our nation really has a race crisis and real urgency around racism. So when I came home in mid-March, the first thing that I saw in the philanthropic sector that was quite incredible was extremely fast movement and a lot of collaboration. I think it was like the first, maybe the second or third day that I was home, and I was invited to join a phone call that's run out of an entity called Philanthropy New York that people may or may not have familiarity with. They're really a hub for philanthropy for individuals, for private funders across the state, and especially in New York City. I've been part of the Philanthropy New York Health Funders Group, and I immediately started being on weekly calls every Friday with sort of the big players in health philanthropy, with Robin Hood Foundation, Helmsley Charitable Trust, the New York State Health Foundation. And the first things I saw, first of all, was just like really incredible organization across entities, across different funders. I think that a wonderful thing about having these calls was my colleagues on, representing different foundations, really wanting to learn from each other, to learn best practices, to say, we typically fund this way around health. What are you other funders doing? How can we react quickly? And how should we be supporting grantees right now? We saw a lot of collaboration, which was pretty incredible. Funders, health funders turning to each other to say, how are you moving quickly and where are your dollars going? Can we do that with you? Rather than kind of keeping grantees and efforts separate. And the other was really an accountability, which is kind of what I'll talk about next, which was, I think, having weekly calls with other funders helped each of us feel more committed to describing the kind of grant making that we were making and making quickly. Because if you show up on a weekly call with major health funders and you're reported that your foundation has done nothing because you're caught up in the bureaucracy of your board meetings, it's not something you want to present to others. So I think that that accountability and collaboration we really saw across funders in New York State really happened quickly. The next thing I want to talk about is actually moving money really quickly. So I don't know what people's experiences are with their own giving, with their own foundations. Maybe some of you are on nonprofit boards that apply for grants from foundations, and sometimes those grants take forever. Certainly, as somebody who works in philanthropy, I would say my biggest critiques of the sector is that grant making can be slow, the process can be lengthy, it can require very long, elaborate applications and reporting, a long time between board meetings. So maybe as a program officer, I ask a nonprofit to apply for a grant in January, the grant gets made in August. That's something that's really frustrating about the sector and is something that really could have happened now. You know, we have, as Darren Walker said, as we've all seen, really a time of unprecedented need. And I think that what was exciting and surprising and really inspiring is that I saw big funders move quickly. Another piece of that puzzle, of course, is that this has been a really uncertain time for the market. And we have often historically in a time of recession seen that foundations can sometimes step back because they're worried about their endowment. So a recession is not always a time where funders step up and give out, you know, tons of grants and expand their portfolios. And it was really quite the opposite of what I would say I saw both with foundations that I work with and also with other funders that I was speaking with. There's an article that I'll share the link at the end of this conversation, but we really saw a lot of leadership, I would say, from the Ford Foundation, from the MacArthur Foundation, from Kellogg, just that they expanded and quickened their philanthropy really early on. I won't get too into the details of it, but the Ford Foundation did something pretty creative and unique and kind of set an interesting new precedent. The Ford Foundation is, of course, like all of us, you know, concerned about endowments being affected by the recession. So what they decided to do was actually to borrow $1 billion, 1 billion with a B, from their bank so that they could issue bonds that were either 30 or 50 years to their nonprofit grantees. A lot of funders decided to make loans in addition to grants. So we really saw, I would say, a lot of creativity around grant making. Another example I want to give of an organization that I was able to speak a lot with over the course of this time is the New York Community Trust. The New York Community Trust, it really was, I was on a call with them like March 13th. They moved very quickly, which I know they're total experts at, to partner with the Nonprofit Finance Fund to launch what they refer to as the New York City COVID-19 Response and Impact Fund. I hope that some of you have been donors to that fund. I know that UJA Federation was one of 18 foundations that supported the fund. They raised within very few short months over $100 million, and they made grants to, from over 1,000 donors, I should add, and they made grants to you know, about 1,000 different organizations. And what they also did through the Nonprofit Finance Fund was make loans to those organizations, which is again the kind of creativity that I would say I really saw in the sector at this time, not just traditional grants, but actually loans, because what organizations, what nonprofits need right now is so particular and so unique that loans have been really essential and really helpful. A few other things I would say about that impact fund that grew out of the New York Community Trust that was really incredible to see. One is that there was a focus on arts and culture, which I think is really incredible. You know, when we have a hurricane or some kind of natural disaster, I don't think our minds go towards the arts and arts institutions. And right now in this unique moment, arts institutions have been so incredibly hard hit, and the institutions themselves, of course, you know, like the Met and the Whitney reopened only last week at 25% capacity after being closed for 6 months. That's a tremendous hit. to the sector and to those institutions, and also the artists. This is an impossible time for artists, for musicians, for visual artists who really truly can't work and haven't been able to work for months, except very minimally, and won't be able to work for who knows how many more months. So the fact that that fund out of the New York Community Trust supported arts and culture, both institutions and individuals, I thought was really wonderful. A few more things I saw, which I'll also touch upon when I talk about the next foundation I'm going to speak about, was that these grants that the trust provided supported technology, especially as we're all now experiencing on this very call, especially helping nonprofits shift their programs to be remote. So, staff, participants have needed laptops, have needed just infrastructure that nonprofits didn't necessarily already have. Another thing that their grant supported was temporary staff to cover for shortages in nonprofit staffs. I have certainly seen with many grantees that I work with that, staff, like all of us of these nonprofits, have been completely distracted. I've had my own toddler at home for months. People have had all sorts of childcare and elder care and mental health needs that have made it very hard to do our jobs and to do them fully. So the New York Community Trust supported funds for nonprofits to fill in their staff with temporary staff as needed. And they also provided grants, as we've been seeing all across the sector, to equipment and supplies to help nonprofits that did have in-person components to purchase masks, hand sanitizer, gloves, cleaning supplies. So Ford Foundation and this New York Community Trust fund, I thought, were two good examples of projects I don't work on, but I'm familiar with, of how sort of big philanthropy has responded to COVID. I'm going to shift now to a project that I do work on. So while much of my time at Rockefeller Philanthropy Advisors is spent supporting family funders, I have also for the last 3 years been working on the launch of a foundation called the Mother Cabrini Health Foundation, which is a brand new foundation sort of born out of the Catholic Church in the state of New York, launched in January of 2019. And because of sort of the nature of this foundation, they have quite a large endowment of $3.5 billion. Last year, we made grants to the amount of $150 million to support the social determinants of health in the state of New York. And this year, we're making around the same size in grant making. So the Cabrini Health Foundation, which is now the largest foundation to serve exclusively the health needs in the state of New York, like the foundations I just mentioned, acted quickly. And this is a foundation with all new processes that I've been working on supporting them on developing over the last 2 years. And they called me and my team probably on March 20th, and they said, our board would like to make $50 million in emergency support grants by June. So at the time, we had no application template. We didn't know who the grantees would be. We didn't quite know who our program officer team was going to be. And we acted quickly, me and my team, to hire up help and support to help get these grants out the door. So I wanted to just share some of the grant examples and things that I learned from current slide. Here we go. So the Cabrini Health Foundation, we made $25 million by May 1st and another $25 million in grants by July 1st. So if you think about all the nonprofits that reacted very quickly when we sent out a call for proposals, and I really commend the board of the foundation. As I've already sort of hinted at, boards of many organizations, especially foundations, can be slow, can be bureaucratic, and this board, which is a brand new board that's only even been in existence for 1.5 years, moved quickly to approve grants and to have emergency meetings and to sort of waive some of the requirements and shift some of the requirements that we've seen in past grant cycles just to make this happen. So we supported with these grants about 200 organizations. Most of the grantees were a mix of community-based organizations, so that's nonprofits, lots of grants to nursing homes, hospitals, and food banks. I have just a couple of examples of the sorts of grants that we were making, tons of grants around enabling these entities to purchase personal protective equipment, PPE. At the time, you know, in March and April, there was real shortages in New York State, especially around masks. So we were on calls with grantees, helping them think about how they were going to secure the supplies that we were going to fund. Tons of grants went to supplying emergency food to food banks and to pantries across the state. The community, the foundation, I should add, about half their grants are Catholic organizations across the state and half are not. There's many grantees from within the Jewish community, UJA Federation, Met Council that JASA that I've been thrilled to help facilitate grants to. So lots of grants around food, lots of organizations starting up new food pantries, especially within their churches, in order to just meet the need. A lot of work to help improve and support just critical social services, lots of case management and assistance to homeless shelters. I know that we had a lot of those grants that I mentioned a second ago about infrastructure and technology. So helping grants that would enable organizations to buy iPads and buy Chromebooks so that their community members, especially those living in homeless shelters, could continue to access, for example, their mental health care that they need by meeting with psychologists over Zoom, since they weren't able to do it in person over this period of time. And then another sort of type of grant that we saw a lot of were grants that provided hazard and overtime pay, especially to frontline direct service healthcare workers. I'll go off of this slide. So just as an example of, I think, what's been really powerful for me in doing this work over the last couple of months, like, first of all, you know, like all of us, I was home in March and April trying to figure out how to work and, you know, manage myself and my life, and having no childcare for my toddler and managing this giant grant making process. And I remember having one particular day where I just felt, you know, like all of this was totally impossible and how could I get it all done? And then I had a call with a potential grantee for the Cabrini Foundation, who I was calling, who worked with a nursing home. And it was, I have to say, just one of the most humbling and moving experiences of my career to speak with a woman who runs development at a nursing home, who said to me, you know, like, we can't have this on the record, it can't be in our application, but 2/3 of the people at our nursing home have had COVID, both staff and residents, and just started listing at her nursing home and at the nursing homes in their community how many people were dying. And that was really before a lot of the news was published around how this was hitting nursing homes, because nursing homes didn't really want a lot of this news to be published. And to be able to be on the phone with this woman and try my best to help her fill out this application so that we could within a month get her, I think in that case it was like $500,000 to buy supplies, to buy masks, to purchase tests, and just to help, you know, the financial needs of this nursing home that was losing all this Medicaid reimbursement from the government for their residents because people were dying and they weren't filling beds. Really helped me understand that sometimes my job can feel, you know, like people sometimes critique of philanthropy, that we're in our ivory tower making grants and not really with the people. And in moments like those, speaking to grantees really at the front lines to move money and to get them the funds that they need was a really humbling and incredible experience. And we're continuing to make grants. I have a call with actually the woman from that nursing home I just mentioned in a couple of days to help them with their fall grant making for the Cabrini Foundation. So now I'm going to talk about family foundations, which is probably more relevant for all of you on the calls. So a couple of just conversations and things that I've seen with our family foundations, and then I'll get to a specific list of kind of best practices that we saw. A lot of the foundations that I work with called me in mid-March and said one of two things. One was like, just give all of our existing grantees $10,000 or $15,000. Just write to all of them and say, we're sending you a check for $10,000 or $15,000. Although I should add, the payment part became a little bit trickier because no one wanted to get a physical check sent to their office because no one was at their office. So a lot of setting up wire transfers, which is probably too technical for this call. So that was one thing that happened, just send more money to all of my grantees. One of my family foundations had us very kind of quickly look at There, I think they have something like 35 grantees, and we looked through the grantees to see which ones we think had the greatest need and were hit the most in terms of their services and the services they provide. And we moved along funds quickly, got larger grants, $30,000, $50,000 grants out the door to organizations that me and my colleagues saw a lot of need in. And then, sort of the next piece, which I'll talk about a little bit later, is that every nonprofit that all of you fund and that I myself fund and my colleagues fund, everyone is hit. Everybody had canceled, fundraising events, canceled spring galas, the recession, a shift in how to move their programming to be virtual. So the need we saw across just every grantee that my family foundation support was tremendous. And part of my job, which again just was humbling and really felt like a blessing, was to call our nonprofit grantees across my clients in the early days in March to say, what do you need and how can we help? Which we were able to do. A couple more examples of the kind of things that our family foundation supported. Food banks, hopefully all of you have supported food banks in your community. If you have questions about how to support a food bank and the differences between local food banks and national umbrella food banks, feel free to ask it later, or I'm going to give you all my email address at the end of this to ask me. Food and moving food to the people in need is just a huge part of this crisis. We all know that there is now, has long been a hunger crisis in this country, which is quite heartbreaking for such a wealthy country, and it's of course gotten worse and worse. So funders definitely supported food banks. The other is cash assistance. So I would say, I know that many funders, foundations, probably a number of you don't always feel comfortable with the idea of cash assistance, which is that people in need should just get the cash to spend it on what their needs are. Foundations don't give grants to individuals, they give grants to nonprofits. So moving cash from a foundation or a funder to an individual in need is not always obvious how to do that. There have been lots of funds that have developed that already exist and also that develop in order to move funds directly to the people in need. An example I'll talk about a little now and also later is the National Domestic Workers Alliance, which is an organization that I have long supported that works to organize and support domestic workers all across the country, cleaning professionals, nannies, elder care, and they developed a fund very quickly in March that you could give to, and then that organization gave out grants directly to individuals in need. So if you were a nanny that lost your job because of COVID, you could apply very easily in either English or in Spanish, and also they support other languages, to that organization, and they would just send you a check for $500. So cash assistance is something that our funders really gave to, and again, many of them don't typically support cash assistance kind of initiatives, and we definitely saw a shift there. Pooled funds, so donor collaboratives and pooled initiatives like the one I mentioned earlier out of the New York Community Trust. We saw a lot of support in those kinds of entities. Places like UJA Federation, we saw a lot of support for people saying, there's so much need, I'm giving my money to another fund, to a community foundation, to the Brooklyn Community Foundation, to the community foundation wherever you are, so that those professionals could decide where the need was and could reach out to the nonprofits and just move money out the door to people in need. Sort of two more things about this, and then I'm going to shift to kind of describing a framework that we use at our PA at Rockefeller Philanthropy Advisors when thinking about disaster philanthropy. So first of all is, I would say, for anyone who's curious, who has a family foundation, that it is okay to fund outside of your funding areas. One example is, I had a conversation, actually, a really sweet, wonderful conversation with my brother and his fiance in June, when the racial justice protests started in the beginning of June, and they said to me, we're having a little bit of a hard time knowing how to support this movement and how to support racial justice, because we, have the nonprofits that we like to support, and my brother's you know, has some nonprofits that he loves, and his fiance has nonprofits that she loves. And they were like, we're so moved by this moment and we don't really know what to do, because like, are we supposed to stop giving, you know, our annual contributions to some nonprofits and switch to these? Are we supposed to add on top of these? And it's the kind of conversation I have all the time with funders, you know, at a much larger scale, which is that it can be tricky for a family foundation that knows that they support, you know, education and arts and culture, to decide right now in a time of crisis how to give. Those are conversations, again, that I really have all the time. So just an example, I have a funder whose passion really is arts and culture. She gives to operas, she gives to ballets, she gives to the Met, she gives to all sorts of cultural institutions in New York and in Paris and in San Francisco. So for her, she, you know, personally was supporting the food bank in her community, but she was trying to figure out of her foundation, like how to give in a way that made sense, that didn't totally veer from what her foundation supports. So first of all, she did just make some grants that didn't have anything to do with the arts, that just had to do with racial justice, that just had to do with hunger. And we encouraged her to do that, even though it was, you know, so-called mission drift, or veering away from what her foundation typically supports. And the other is that we encouraged her, and I encourage all of you to think about how to support the need in this complicated moment, but with the lens of what you usually care about. So for this woman whose focus is really arts and culture, we helped her find a fund that specifically was giving cash assistance to artists who were in need. So we found her an organization, and she gave them funds, and then those funds directly went to artists. So sort of things like that, of how do I you know, approach the need right now, which doesn't totally align with the sort of issues that I usually fund, is the kind of work and the conversations that I have all the time. So one more piece, and then I'll switch to this next framework, is something else that I thought was really cool that I saw in the field were giving pledges. You know, I think probably many of us know about the giving pledge that many billionaires signed on to over the course of the past, maybe it's been like 10 years or so, to give away a certain percent of their wealth. We saw a pledge, I think maybe it came out like in April, and I'm gonna give you all the link at the end of this, which was a pledge that funders, both big foundations and individuals, signed, like basically recommitting to the nonprofit sector. So a couple of things that came up in this pledge that I encourage all of you to sign, because it's a good thing to be accountable to, and I will share my screen again, hold on, current slide, is a couple of best practices. So this is like, these are coming from an actual pledge that I encourage you to sign on, but this is funders committing to give donations with as few restrictions as possible. So if you're a funder that typically, when you support an organization, ask that organization use these funds specifically for one kind of project, like I'm giving a donation to a school, but I only want the dollars to go to 4th grade, we encourage you, as does this giving pledge, to not do that, but to actually give in a way to nonprofits that enables them to be as flexible as they need with the funds. The next is that donors, we're encouraging donors, and this pledge is encouraging donors to give support for the immediate and longer term, and I'll talk a little bit more about that next. But when we, you know, in a time of crisis, I know we all kind of want to be helpful right away with our dollars. So we want dollars to go to an organization. We want them to spend it. We want them to just, you know, move on that urgency. But organizations, especially now, have intermediate and long-term needs coming out of this crisis. So we encourage you to give funds to the nonprofits you care about, but not in any way ask them to please spend the dollars only now or only in the next 3 months, but give them the flexibility to decide when they want to spend those funds. The next, and this is sort of something that we at RPA and that the field kind of always encourages around disaster philanthropy, is that it's really important to give funds to organizations that are already really active and experienced. so that they can keep growing their capacity to support the field. I actually just had a conversation with a client earlier today. She's interested in a nonprofit that has like a quite enormous budget. I think they have like $100 million in expenses annually and a much, much larger endowment. Sometimes when we see an organization with a large budget, our instinct is not to give to them because we feel like our donation is just a drop in the bucket. Still give to those organizations. They have large budgets because they know what they're doing. So the next, I think I already talked about a little bit, which is just the power of giving to funder collaboratives so that you can help leverage your dollars a little bit more. And then the last on here, and then I'll point to a couple more, is again, really that it is appropriate at this time to give outside of your traditional giving areas. If you're someone who always funds the arts, you can still fund, you know, COVID response with an artistic lens. You can also just make a grant to a food bank out of your foundation, even if you otherwise only give to the arts. A couple other things which are like a little bit technical, but I'll mention that both we at RPA and I advise, and also that this pledge recommends, which I'll send later, is if you have grantees that for whatever reason you ask them to submit multiple reports a year about their progress, I would encourage you to loosen that. Either say, you know, please don't submit 2 reports this year, just submit 1, or the report that we've asked you to submit is 15 pages long. Here's an abbreviated report. Please fill out this one instead. I also really recommend transparency with your grantees. I know for me, with the grant making out of the Cabrini Health Foundation, it was really important for me to be able to say to them actual timelines. You know, you've submitted an application on April 15th. We will have a decision on May 1st. Grantees, you know, are really in need of funds right now, and to give them more transparency around your timeline rather than a guessing game is really critical. And one more sort of connected thing that I would say has always been critical in philanthropy, and now more than ever, especially in light of the racial justice movement that emerged in June, is really that I encourage funders as much as possible to give to nonprofits that are Black-led and that are led by people that are in the communities represented by the work. I do a lot of criminal justice grant making, and it's a big priority in that grant making for me and for my colleagues to support organizations that work on criminal justice that actually have staff and board members who have been incarcerated. And I'm happy to share lots of materials with you about that, about how much more effective those organizations are that represent the communities they come from. The last piece just on this slide, and then I'm wrapping up pretty soon, so we'll have time for questions and answers. I'm just going to say this is like a call to action from me and from the sector, and very much from the Black Lives Matter movement, is that if possible, I encourage any of you who can, especially who have a foundation, to double your grant making payout. I've been working with a lot of my funders on this. Probably many of you know that foundations only have a requirement to spend 5% of your endowment a year. That's a very small amount, even if your foundation is very large. And there's no reason for that. It's because the IRS only requires 5%. If you can double that to 10%, please do it. The need is tremendous, and your 10% will make a difference, or go above that. I also encourage you to keep spending down from your donor advised fund that you have with JCF or anywhere else. That if you have funds, if you have charitable funds that are sitting in a bank account, please spend them, please make grants. The need is really tremendous right now. So let's see, 2 more points I'm gonna make, and then I promise I really will open for questions and answers. So one is sort of about how do I fund right now during a time of crisis. So Rockefeller Philanthropy Advisors has long advised on crises. We especially worked on distributing funds after September 11th and in the Gulf and after Katrina and various hurricanes. So we kind of have this framework, which I'm happy to share out after the presentation also, which is that nonprofits and funders have 3 phases of need and 3 phases of giving. The first phase we'll call survival. So any grants that you made in, March, April, May of this year was really the survival phase of the response to the COVID-19 crisis. That helps support organizations and the communities, just their basic needs to get through this crisis, to move funds and run virtual programming for their communities. It's really easy to stop there. I'm gonna confess that I don't think that I've actually made a donation, I don't think since June, and that's too long. So I'm committing on this phone call to making more donations to the organizations I care about today and after this call, because there's 2 more phases that we see kind of in a disaster time. The second phase is the rebuilding phase. I would say that probably a lot of nonprofits are in this phase now because we've had this crisis now going on for 6 months. So organizations now need more funds than the funds that you gave them in March. These are funds that really will help them hopefully recover from all of the canceled fundraising opportunities and events if they're an organization that earns revenue from programming they run. Everyone has made a fraction of that amount of money when they switch to virtual programming because people just aren't willing to pay as much. So rebuilding is the phase where you as donors continue to support nonprofits, not just in their initial kind of urgent survival needs, but also in their ongoing needs. And then the last phase of sort of disaster grant making, which who knows how long this will go on for, none of these kind of come with defined timelines, is resilience. And this is really that we encourage you as donors to continue for the rest of the year and certainly in the year to come to keep partnering with the nonprofits that you support to help them become stronger into the future, that you'll give them grants that will fund their infrastructure and their salaries, improve their systems. Like even a food bank has need beyond the dollars that you give them towards buying food. They also have need to pay their staff and to build their buildings and to maintain their buildings and to buy vans and to pay for gas for their mobile pantries and all of those sorts of things. So I'll just end, and then I'll promise I'm turning to questions and answers by saying just kind of what I personally did. So I would say that in my own personal giving, I have kind of long tried to live by the framework that my mentors at American Jewish World Service shared with me years ago, which is to give local and give global and give Israel. So I would say that for me in March, almost all of my giving really was local, really was to New York City. I gave to City Harvest, I gave to the Restaurant Workers Community Foundation, which was cash assistance for the many restaurant workers that lost their jobs. I gave to the National Domestic Workers Alliance. In my own personal life, as I mentioned, we have a toddler, we have a nanny who is so critical to us, and this fund was to help support especially lots of child care workers that became out of work. And then I also gave to my giving circle. I'm part of a giving circle with the Gerot alumni community called Hekdesh, and that's a place that's like a pooled fund that I give to that also gives funds, especially in Israel, to support the need there. So I can certainly say that I feel pretty good about what I did in this first phase of giving, in this kind of first survival phase. And now is the time for me in my own life to think about the rebuilding phase that the nonprofits I care about are in, and that I should be in as a donor. I have some resources. I won't put them up on the slide, but maybe the team will help me share after the call. But those are my remarks, which of course went on longer than I expected, but as you can tell, I'm pretty revved up and passionate about this topic, but I'm happy to take questions that have come to Tamar during my presentation.
Thank you so much, Naamah. I appreciate it. That was such a fascinating talk and so helpful. So we have a question that came in asking if you could please mention several of the coalitions responding to the crisis in the tri-state area, give us some names, and explain how they track the changing needs and get the funds out to the most effective charities. How do they determine that? What's their process?
Yeah, great question. I'm not going to be great about tri-state area, but I will certainly track those down for you because I have lately been working pretty much in New York State, but I will definitely find entities for the rest of you from the rest of the tri-state area. You know, I think that definitely the fund I mentioned from the New York Community Trust is a really wonderful place to give. The you know, pooled funds that you all already give to across the Jewish community are a wonderful place to give. And really, like, the reason why I think these coalitions and umbrella organizations and pooled funds are so wonderful is because when you give a donation to one of those entities, they have a whole team of experts that is doing a couple of things. Number one, they're managing a process, which I can tell you as someone who manages grant making processes, it's a lot of work. You probably don't want to do it yourself. So they're managing a process with expertise. They are in conversation with grantees all the time. So they know where the need is. They have always known where the need is. People who work at these coalitions and at these pooled funds. And nonprofits are comfortable reaching out and asking for their needs. And they're really, these entities going to help manage a process towards resilience for nonprofits in need, and to help make sure that funds don't all just go out in the very beginning, but that organizations keep getting not only grants, but also what we refer to as capacity building, also like the non-monetary support. So, you know, coaching, fundraising assistance, technical assistance, all of those things. So I'm going to get back to you about specifically funds that I didn't mention outside of New York City, so that we have some more of those on hand.
Great, thank you. And maybe we could send that out in a follow-up email to those who attended. Okay, another question that came in is a question about those organizations whose future looks very uncertain and not sustainable. Maybe they're small, maybe they're having trouble, more trouble that, you know, everyone's having trouble, but even more so. How do you decide if you should keep funding them because their need is really great, or recognize that they're not resilient enough to survive?
Oh, that's so hard and a really heartbreaking question, and a really important and hard one, which of course is like, the answer would only be completely subjective and case by case. I did have an example so I'll just give one example. I had a grantee for one of my family foundations that actually manages a bail fund for people in immigration detention in Boston. And this particular fund, or this particular organization, typically gives 3-year grants, which is wonderful. I recommend you all do that. But because in conversation with this organization, we realized just that the work that they're doing is shifting so much because of the nature of detention in the country. And for them, it wasn't that they don't have enough funds, and I'm concerned that they won't be financially strong enough to support, but it was just so much uncertainty. So in that example, what we did is we gave them a grant, but we gave them a 1-year grant instead of a 3-year grant because 2021 just sort of felt too uncertain. So it may be for whoever asked the question, or for any of you, that you may want to give, if you would typically give a multi-year grant and you're worried that this organization maybe won't be around next year, start with a 1-year grant instead. You know, the thing that's so tricky is that if you see that an organization is in really bad financial shape and it seems like unlikely that they might be around next year, and you're going to give them a $10,000 gift, I would certainly understand why you may not want to give them that gift. It may be worth trying to have a conversation with them, try to understand, you know, where they're at and how those funds might be used. I do have donors that have, you know, very large giving capacity and may be able to make a grant that could save the organization. I was very, you know, grateful to get to facilitate some of those this year, grants that were like, you know, $250,000 that really made the difference to organizations that were really in trouble. But I can, of course, understand, and I give you permission if that's what you're looking for, which I would totally understand, that if there's an organization you support and it really feels like they need so much money to kind of make it to the other side of this crisis, and that you're not able to provide that size grant, that you may want to fund a different nonprofit in a different way that you feel more comfortable with at this time.
That's very helpful. And I think we'll end off, because we're running out of time, we'll end up with one last question. We have a few people who are asking about more information about local foundations or groups of donors who are doing impact funding in Israel, maybe related to Corona or beyond. Is that something that you could shed light on?
I don't have particular names of organizations. I can promise you that other people on this call probably have a better answer for that than I do, because I'm not sure of actual names of organizations you might want to turn to. But I welcome Ellen or anybody else to share on that.
Right. I think we might get to that in one of the future webinars. This is a 3-part series, so I think that we'll definitely make sure to include that in one of the future webinars. Okay. Just give me one moment. Okay.
And our deepest thanks to Naamah and Rockefeller Philanthropy Advisors for sharing her wisdom and helping JCF provide information and resources to our fund holders to better achieve our philanthropic goals. And thank you all for joining us today. And please register for the next webinar, as mentioned, in the series coming up on September 15th at 9:30 a.m. Tools to help respond to the crisis in our changing world, featuring philanthropic advisors from Good Nation. You'll be receiving this registration link later today. And thank you all again, and have a wonderful afternoon.
Thank you, everyone. Thank you for the invitation and for joining. I really appreciate the opportunity.
Have a good day, everyone.